Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, Chief Medical Officer of Good Samaritan Physician Network. Joined today, again, as usual, with Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We will be going through our usual list, updating you on statistics, kind of where we're at with COVID in our community, what some of the big occurrences have been over the past few weeks, and where we think we're going to be over the next few months. So first of all, kind of leading off on active numbers, probably one of the most exciting numbers that you just told me about, which is number of active cases in our community, is around 100. I honestly don't remember that number being that low for probably 5 months, maybe even beyond. And then the other numbers that we talk about every week is all positives over the past 7 days and then unique positives. And the all positivity rate is around 10%, which again is probably one of the lowest numbers we have seen in months. And then 25% for the unique individuals. And this is very important, especially combined with the active number of cases in the community. As we build up immunity, as we have more people vaccinated, although we're not reaching the herd immunity numbers that we would be shooting for, every day that goes by that we start chipping away at that, and every day that goes by that we have more individuals vaccinated, we are getting closer and closer to that. And we are now outside of that window that we've spoken about time and time again with regards to the holidays. We're a few weeks post-holiday. We've kind of passed that 2-week blip. So although we're not really slapping high fives yet, I think the exciting thing is we're seeing those numbers come down, and it's not just a temporary drop. We've seen a pretty good slope of decline.
Sure. Cautiously optimistic in,
Yes.
in what we're seeing. And those numbers are certainly something that we're happy to report on, and really seeing that align across the board as we've seen our community numbers trend downward. Also here at the hospital, the number of acute cases and the pressure on ICU and ventilator and supplies and many things that we've talked about in the past that have been manageable but tight. We're seeing some relief on that side as well. So those are two really positive trends that we want to continue to see. I know Governor Holcomb also announced kind of the cautiously optimistic look across the state that even though seeing a number of new cases, that pressure at a healthcare level, the acuity of cases we're seeing down, and certainly some of that ties into some of the treatments that have been developed for outpatient over the last 2 months and really have had an impact. And I think to the viewers that look at the color coding, they immediately say, okay, all of this is positive that you guys are reporting, but our county still says we're red. The reason for that is anytime in Indiana when a county turns red, no matter how the data changes, there is at least a 2-week period that will stay red and kind of watch to see what variability we're seeing. I would predict that later this week, as long as everything continues to trend the way that it is, we'll move back to orange. And then the counties around us will also look in that way, because Southwest Indiana, we're seeing consistency from Knox County to other counties that are trending in a good direction, really for the whole District 10 Southwest Indiana region.
And really, probably the biggest highlight, if we look over the course of the past week or so, is certainly the vaccination system, what's been going on with that. If we look back to late November, early December, when we had our practice round with the flu vaccine and we're kind of ramping up, I don't think that we could have ever conceived that the rollout here locally would have gone as well. I think it's been super well planned. I'm very proud of what the hospital has done, our volunteers have done, our pharmacy staff, and all the individuals who have made that happen. One of the big statistics that stood out last week was that we're the highest percentage of our population as far as all the counties in Indiana. I don't know if you can speak to that, but I think that's tremendous.
Sure. Yeah, that's been making its way around social media and has been recognized. Knox County, the highest percent per capita of vaccinated residents, and that's pulled based off of the resident's address, so where they live. And we're really excited about that, and just below 10%, so a lot of work yet to be done, but really shows that at the onset, December 17th, started receiving vaccine. Our focus was fill the clinic, get folks vaccinated. We're not vaccinating freezers. We're vaccinating individuals and getting the vaccine out and getting it into our community. And we've been successful in doing that. And that means a lot of people have also, when they've been eligible, signed up, rolled up their sleeve, gotten vaccinated. over 6,300 vaccines have been delivered in Knox County. About 25% of those are second doses, so those are fully vaccinated. And just to put that in kind of perspective, the state is now over 400,000 vaccine and about 25% fully vaccinated. So we're certainly doing our part, and that turns into now what does eligibility look like? So currently we're at 70 years of age plus, and then healthcare workers, first responders are eligible. There was some anticipation that this past week that would open up further to 65 and older. Just again to kind of put it into the numbers, 65 to 70 in the state of Indiana is another 350,000 Hoosiers. And clinics are filling up, and we get 80,000 doses across the state every week. So just playing it by the numbers, they decided to hold on that. Our clinic is booking out into February 9th and beyond now. So we're filling up, giving over 300 doses per day in our clinic. So as we get more vaccine, and certainly, this goes all the way up to the federal level. Biden administration has said first 100 days, which is always kind of the president set their first 100 days goals, that they really want to push forward more vaccinations. I believe we're just north of 20 million doses in the country, and they want to push that to 100 million in the first 100 days. So what we anticipate is that means Indiana will receive a fair share allocation of that, and we'll start to see more weekly allocation that will allow us to expand and continue to grow our vaccination. And then we'll see that 65 age plus. And I know you, as a physician leader in the state, were involved in some discussion of, okay, how do we start to incorporate high-risk individuals into that, which has been an ongoing question that we don't have the answer to yet, but we know it's a topic of conversation of how do we incorporate those individuals into the vaccination plan.
Really, as Adam was speaking to there, probably one of the most important things is looking at who has been vaccinated so far. And so since we've been through the 1A and into the 1B and looking at that 70 and older crowd and our higher risk individuals, even though it is still a relatively small percentage of our population, it is a much higher percentage of the population that we consider to be at greatest risk. And so although it will take months and months and months to reach 50% or herd immunity or whatever we want to designate as that number, the most important thing when we look statistically at who has suffered the most from this and who has had the most deaths, it's definitely age is one of the highest risk factors. And then, of course, along with that, those other medical risk factors that predispose. And as Adam was talking about, we are looking at those in terms of cancer patients and COPD patients and patients who have chronic kidney disease and those types of things. So we'll keep you informed over the next week or two as to how that rolls out. But a lot of it is based on what that availability of vaccine is. And thankfully, we have seen consistent allocation, and it's been speedy in the logistics of how that's been distributed. And then once it gets here, it's being distributed and put in arms as quickly as possible. Now, some of the questions that have come up as we've been rolling over this last few weeks or so has been efficacy of the vaccine, how things are going as far as safety is concerned, how long does the vaccine last, when should I get it if I've had the illness, and just to kind of address a few of those things individually, probably one of the most important things is this has been a very safe administration process. We've seen virtually no adverse reactions. We've had certainly some comments on sore arms and a little bit of malaise and being a little fatigued, but for the most part, we have seen almost no significant reactions over the course of the past few weeks or so. The other thing is the question of immunity and how effective it has been. And thankfully, as we roll through every week and every month, there are studies being done looking at what the current genetics have been on the virus, what some other variants have been around the world, and thus far the vaccine has been performing very well.
Yeah, certainly it's made headlines, the two well-known variants of COVID that have developed with the UK strand and the South African strand. And with those two, what that immediately turned into, let's get it to the lab, test it against the current vaccines. And while there are certainly so many pros to when your time comes getting vaccinated, this is just another one. The vaccine is effective against the mutated strains that we're seeing. And the other thing is, everybody wants to talk about will it keep mutating and will it change to a point where the vaccine isn't effective. The sooner we get everyone vaccinated, the sooner we reach a herd immunity where the vaccine or where the virus is not being transmitted and not continuing to be able to mutate, that stops. Yep. And then we have that herd immunity, and that's where we get to a point where this may not be a vaccine that always has to fight a mutation. The faster we can move, and certainly we're trying to do our part. As soon as we get vaccine, we're doing that. But it also counts on, as the eligibility increases, folks getting signed up, getting vaccinated when your time is up to do that. And you mentioned on the safety profile, I got some questions over the weekend, and I think it's just worth noting 20 million plus doses given in the United States. And you see a couple of headlines, and certainly it's from a media standpoint, it's much more flashy to talk about a post-vaccination death of an individual in California or in other countries or here in Indiana than it is to say the vaccine's safe. I mean, that doesn't get headlines, that doesn't get people to click on it and read it, but saying that somebody died from the vaccine does. 20 million doses have been administered. Out of those 20 million, you take that data, we could probably tie some deaths to coffee and breakfast and breathing.
Yes.
Everything. What we're seeing with the vaccine is that it is safe and effective, 94-95% effective, and from a safety standpoint, its profile compares to all the other vaccines that we get. It's no more, no less. I mean, really, we're seeing the side effects that just fit normal vaccines.
Right. And the other thing that's important to look at too is I've had a lot of questions about, well, how long does this vaccine last? What do we know about that? There have been a lot of comments and questions about, well, this 90-day issue, when should I get it? What if I have had the illness? When can I get the vaccine? And certainly the first answer is we want people to be fully recovered from their illness before receiving any vaccine. We want your immune system to be ramped up and moving on. And any commentary that's been made or that people hear about waiting 90 days after, really there's not as much science behind that as there is to say, hey, we want to make sure that individuals who haven't had the illness and don't have immunity have access to the vaccine. But there's not really any issue as far as how long the vaccine is going to last at this point in time. We certainly believe that it's going to last throughout this phase of the pandemic, as you're saying, until we can reach herd immunity. The question will be, and it's being studied now, will this last into the next year or into 5 years or into 10 years? And this is no different than the majority of the vaccines that we deal with, childhood vaccines, the shingles vaccine, these types of things that are studied and released and then are continued to follow for years and decades afterwards to determine if booster doses are necessary. For those individuals who are 65 and above, they may have heard me over the course of the past 22 years recommend 3 or 4 different methods for giving pneumonia vaccine. And that's because that continues to be studied. When should it be given? When should it be boosted? And we will go through the exact same thing that we see with the other vaccine processes. So most importantly, safe and probably the biggest thing that separates this vaccine from the herd of every other vaccine we've seen is efficacy. To see somewhere up in the 94 to 95% efficacy range is absolutely unheard of in terms of vaccine efficacy. So we're very excited about that. And again, we would encourage individuals to get out, get vaccinated when your time comes. There are individuals that have kind of waited to see how things are going to go, and we can certainly say with assurance that things have gone very well and very few reactions, and thus far the administration has been well. Now, that being said, the other thing that's big is what's happening in the meantime. What are we doing to kind of bridge the gap? And we talk about monoclonal antibody infusion, and it's been fairly exciting to see how good that has been in individuals who hadn't gotten the vaccine, who got the illness, and then come down with the illness. And what do we do in the meantime? And that has gone very well, and our numbers have been looking good with that too.
Right. Over 320 doses have been administered here at Good Samaritan. We have a well-oiled process for identifying high-risk individuals that would benefit from that treatment, that when we say high risk, have a high risk of having a difficult time recovering from COVID, as well as a high risk for ending up in the hospital. It all starts with getting tested. So when you have symptoms, getting tested. And that happens at our convenient care through a virtual visit with your primary care provider, and then testing at the medical center. If truly in distress, coming in through the ER, and then can be identified that way. But it starts with that positive test, and then Dr. Stine, Dr. Mahan get involved from a consult standpoint to look at risk factors and potential for progressing to needing an admission, and then that infusion happens in our CDU, and it's about an hour-long infusion, a couple-hour process, and we've seen really good results. Only 3 admissions into the hospital out of that over 320 individuals that have had doses administered, and the data would tell us that 20 to 30% of that population typically get admitted. So without question, it's been very successful. I think Indiana has been, as a state, one of the leading states in administering monoclonal antibody treatment. We certainly have seen now the country has gotten more on board with that, which becomes some supplies going out. And so we've seen our allocation change, but not to the detriment that we haven't been able to treat individuals. And it's still been a very successful program that we feel like we've really been on the forefront of leading the way with that.
It's been really impressive because this population, it tends to be our highest risk patients, some of our sickest patients, some of our oldest patients with multiple comorbid medical problems and conditions. And so what we have seen really has been over the course of the past few weeks or so, when we follow up with those patients after a couple days, they report that, especially if they got that infusion in the first few days of their illness, that the turnaround is very dramatic, and really over the course of the next couple days, they see things improve relatively quickly. So, as Adam said, probably the most important thing with that is being identified early, seeing your provider, getting tested, and then the administration, really, that's the majority of the time when we find those individuals, they're receiving that infusion that same day or the next morning. And timing is really key, because we know once people get infected and that viral replication begins, we're off to the races, and we're battling to make sure that the immune system picks it up, and this is really a booster to the immune system to help get over that more quickly. So it has been fairly exciting to have that available, and it's been a really crucial tool that we have as we are rolling out and getting people vaccinated to bridge the gap.
Yeah, and I think it's worth noting both on the bamlanivimab monoclonal antibody program as well as the vaccine. These are federally funded programs. So the monoclonal antibody treatments are coming to us funded through the federal government at no cost. There's an administrative fee here that is charged to insurance, but it's nominal. The drug itself is of no cost to the individuals being treated. And then on the vaccine side, that is at no cost to the patient either. If you have insurance, your insurance is billed, and then if you do not, though, it is covered through the federal funds, through the CARES Act. So there's no out-of-pocket cost. It was really important to the government across the country to make sure that economic factors, financial factors were not playing a role in who got vaccinated, who could get monoclonal antibody treatment. So that barrier has been removed. So I think that's a question that comes up from time to time. Well, what's it going to cost? There is no out-of-pocket cost to any individual.
Yeah. And the other thing is signing up for the vaccine has been streamlined a bit. When we go back a few weeks, there were a couple separate processes that were going on. Really, if you go online and Google Our Shot Indiana or ourshotin.gov or ourshot.in.gov or a whole variety of things, it'll take to the appropriate site to get signed up for that. And then I think the call-in line has also been functioning better as well, from what I understand.
Yeah, the 211 line, early on, they were trying to match the number of calls coming in with resources, pulled a lot of people in, and I know there were some hiccups, individuals getting scheduled for COVID testing instead of vaccinations. I believe that's been cleaned up. The 211 line is a good resource. So ourshot.in.gov, 211 are how to access to make appointments. For our local, calling our clinic is not how to do that. That phone does ring off the hook, but really state directive is that the scheduling of appointments should go through ourshot.in.gov or call 211 for support on that.
And one of the things we talk about every week is what's happening with the schools. All the schools are back to in-person learning, which is fantastic. Things have been going well as far as the sports programs. And then we look at this really every couple weeks to see how things are going. Now, one of the things that we kind of got an early jump on, because one of your initiatives is getting our school providers vaccinated, and that has gone very well. We received some praise from the state this past week as to that initiative, and the fact that really when we look at the schools have done well, and part of that has been to keep the teachers healthy and keep the administrators healthy and keep the lunch people healthy, and that population is really the ones that have been at risk at the schools, and that has gone very well in our community.
Yeah, and that's a population that we saw really jump in, get vaccinated. This past week was kind of round 2, where we saw a lot of them go through and become fully vaccinated, and like you said, it was all about that in-person learning, having the staff protected, and the the domino effect of not doing that is that kids stay home, and then our healthcare team stays home that is taking care of the community. So we really wanted to make sure that we pushed that forward, and it was at a time that we didn't have a lot of appointments, and so we were able to do that within our current inventory of vaccine and manage that with the goal being get it out of the freezer, get it into arms, and get our community vaccinated.
And then one of the final subjects that we always talk about is what's happening with visitation. And while we want to open up visitation as quickly as we can to family members, we continue to look at what our numbers are, what those positivity rates are, and what the color of our county is. But that's something that's evaluated basically every day.
Yeah, it's an ongoing discussion, and there are always different scenarios that come up in our nursing team and their group, pastoral care management, that whole team come together and talk about visitation on a regular basis. Where we're at today and really will be for the foreseeable future is we allow one visitor from 10A to 6P in our inpatient area. In the outpatient areas, there's no visitation other than those that are power of attorney, medical decision making, where it really impacts the care of the patient. And we just ask that everybody try to follow that. And we know it's a balance of family being there for your loved one and navigating that, and it's a difficult time and sometimes can be challenging in how we do that. We have window visits for patients. We've been able to do window visits now on third floor, and that was engineering and nursing came together and created a process that is really something innovative to really pull our families in to be able to be part of the care. And so we're constantly balancing that, but right now, even though our numbers look good, on that cautiously optimistic side, we're still following the mantra of keeping traffic down in the hospital is the best approach, where patients, all services are open. We're not keeping traffic down from patients seeking care, just where visitors, where that traffic can be kept down. That's the best case scenario for everybody.
Any other things before we move to the phones?
The only other thing that I would mention on the vaccination, because there's been some news circulating about this, is we are looking at the now third vaccine, the J&J vaccine, which is a single shot vaccine, is starting to have those discussions at ACIP, which is the Advisory Committee for Immunization Practices. That's who recommends it gets approved for emergency use. Those conversations are starting this week. That's a starting point. That doesn't mean it'll be approved this week. It won't be available. We're still looking into February, late February, before that will happen. But that does add to having more supply to meet demand. I think one thing that I've already heard and have seen is, their data show, they're one shot, but it shows 70% effectiveness, and immediately everybody says, well, it's not 95. Keep in mind that when the FDA set out for these vaccines, that a 50% efficacy got you approved. 70% is really good.
Yes.
And how that data is collected, there's still much to be seen as far as how it will compare to the other vaccines. But it is moving forward, and we will have that likely late February, early March to add to the vaccine program.
Right. Do a little quick check over my shoulder for the Bernie mitten meme. You don't see it. So we'll proceed with go to the phones.
Well, I saw on Facebook this weekend that he was at our vaccine clinic.
Yeah, I'm anticipating that he's right here, right now.
No, we'll see what
Let's see.
So several questions this morning. One of them, someone asked, is it true that if you get COVID, you can't get it for 6 months? Also, you could test positive, continue to test positive for 6 months.
Sure. So first of all, the testing positive. We definitely do not encourage people to do test of cure, what we would with other potential illnesses, but we do not encourage people after they have been positive to go back and get tested for weeks and weeks and weeks afterwards, because it's possible that that test will be positive because we are picking up some of the dead virus and the antigen and so forth that's left behind. The other question is how long is your immunity and how long will this all last for, and can you get sick again and basically what we have seen, and there have been very few cases when they go back to the very beginning, March and April, where there were only a few individuals that then basically were able to get sick again within the following few months or so. So first of all, we think that that is very rare. Most of the time, whenever you have had this illness or influenza for the year or whatever, you have immunity for that entire season, and we would anticipate the same thing. So certainly, as far as when it's okay to get vaccinated, as soon as you've recovered fully from your illness, it's okay to get vaccinated. But as far as the precautions of, I think I could get sick again within 30 days, 60 days, 90 days, the likelihood of that is very low, and the likelihood even over the course of the next 6, 9, 12 months is extremely low. There are only a few isolated cases where people have been shown that they have had it early in the pandemic, and then later this past fall basically came down with the illness again.
And you mentioned 6 months. I think what CDC has put out there has been more of a 90-day window as far as natural immunity. We expect that it lasts longer than that. Those are almost always conservative numbers. Just as a kind of piece of that, our internal policy is at Good Samaritan, and this is true across most hospitals in Indiana that I'm aware of, if you test positive, we won't retest for 90 days because what Dr. Stine mentioned, remnants of the virus can stick around, will test positive, and those are not really beneficial results because you get that positive and it doesn't tell you anything clinically.
Okay, now this next question is a first-time question that we've had. Are stylists who do post-mortem hair of people who have passed of COVID at risk? They are at risk. Should they be able to get the vaccine?
They certainly wouldn't be at risk as far as that postmortem hair care. However, if they are providing normal services to individuals, then yes, because of that contact. Now, we encourage everybody, obviously, to continue with masking. We expect the person receiving the services and the person giving the services to be masked at all times. Obviously, it's going to be difficult to social distance in that situation, but no different than the way that we administer care here within our retail facilities, pharmacies, restaurants, so forth. It's just important to do your due diligence and do the best that you can as far as that. But no, as far as the potential infectivity for people who have died and are receiving that service, that's not an issue.
Keep in mind, we spread this virus through talking and expulsion of respiratory droplets, and so anything post-mortem, there's not going to be breathing and any expulsion of droplets, contact, skin contact, anything along those lines is not a transmission factor for COVID.
Another question is regarding the second dose of the Moderna vaccine. Of course, they have to get the same vaccine for their second dose, so they ask if they can get that anywhere.
So yes is the short answer. Same dose and same manufacturer. So Pfizer, first and second dose have to be Pfizer. Moderna, the same. If your first dose is Moderna, second dose has to be Moderna. The two doses for both vaccines are the same dose, both first and second. Pretty consistently across Indiana, hospitals are giving Pfizer because of the ultra cold storage capability, and health departments, long-term care, pharmacies are rolling towards the Moderna because it can be stored in a regular freezer and is given a 28-day interval. Pfizer is a 21-day. Where you go geographically, if you got Pfizer first dose here, and then we've had this happen. We had an individual that got their first dose here, and then in 21 days they were actually going to be in Denver, Colorado on an assignment working there, and asked could they get their second dose there. You get a vaccination card, and our direction was you have to get Pfizer. So make sure you check your resources and get Pfizer. You know, we've had a number of individuals that snowbird to Florida and want to get first dose and then go to Florida, and the recommendation has been call the county and where you're going to Florida and make sure that you can get Pfizer or get Moderna, whichever one you get first. But you don't have to go to the same clinic that you got the first and second. Certainly it's easier because we have all the information and we know, but that's not a rate limiting step. You can, as long as you get the same vaccine, you can get it anywhere.
Now, should someone with several allergies to medications get the vaccine?
Sure. The answer to that is relatively simple in the fact that we always look at people's allergy history whenever we're administering any medication or any treatment. But generally, the most important thing is just to look at if there's any commonality amongst any of those chemicals. Now, Adam can certainly speak to this more than I can. There are little sulfa groups that are tacked onto a whole variety of medications, but don't necessarily have anything to do with vaccines.
Right.
Some of the concerns people have had in the past are of previous reactivity to vaccines. And unless that was a major adverse reaction, it is still safe to administer vaccine. We have a number of individuals that routinely have had red arm, sore arm, irritation, rash following flu vaccine administration in the past, tetanus administration in the vaccine in the past. We still encourage everyone to still get the COVID vaccine despite those types of reactions, because the way that the vaccine has been made, the components of the vaccine, very different from that. And the other thing to speak to is many people will have had reactions 30, 40 years ago to flu vaccine and things like that. The way that those vaccines were manufactured 20, 30, 40 years ago, very different than what's being done today.
Yeah, the simplest answer from the medication standpoint is that there are no medications that have been identified as if you have a severe allergic reaction to X drug, you should not get the vaccine. There's nothing specific to that level. As Dr. Stine mentioned, we have had individuals come through the clinic that have had a past influenza vaccine reaction, have gotten the vaccine and done fine. There's a 15-minute observation period after you're vaccinated where we watch you and you watch your own self symptoms as far as how you're feeling. Everybody has done fine in that regard. We've had some individuals that have a history of reaction stay longer. We've had some stay up to an hour just because they have a history of reaction. Really, the only guidance that's out there so far on a more specific matter is these vaccines are not made with latex, they're not made with egg, they're not made with preservatives. So if you have allergies to those, vaccine is fine. What we have seen is that there are inactive ingredients that help with giving the vaccine that are called PEG, polyethylene glycol, and polysorbate. Those are just soluent liquids that help to give the vaccine. If you've had a reaction to those and know that you have, which is a very small group, then that would be, we would start to ask, okay, what type of reaction did you have? What's the benefit risk of getting the vaccine? We have not had to use this in any regard, but I will also tell you that our vaccine clinic is 20 feet from the ER. So if somebody did have a significant reaction, our team is there like that. So that's also of a benefit of getting the vaccine in the hospital. But really, allergies to medications is not a reason to feel that the vaccine shouldn't be administered.
Yeah, and those substances that you mentioned that are additives or solutes within the vaccine are in everyday items that we encounter every day, literally. Every time we eat, the foods that we consume, the products that we use, those particular substances are common amongst all of those. So it would be nearly impossible to walk the earth and not encounter those on a daily basis anyway.
Okay, someone asked if a patient has recently recovered from a flare-up of a serious health issue like heart failure, is it safe for them to get vaccinated ASAP, or do they need to wait a period of time?
So generally, if you are recently recovering from some other type of illness that is non-infectious, we would encourage you to go ahead and get vaccinated right away anyway, because, of course, that illness that is recently exacerbated, whether it was something associated with heart failure or kidney failure or otherwise, your immune system takes a little bit of a hit from that, and we want to make sure that you're covered. If you've had a recent infectious type illness, then we want to make sure you're fully recovered from that as well, whether that has been pneumonia, diverticulitis, appendicitis, some other type of issue. The other thing which we've spoken a little bit about in the past is trying to space this in between steroid shots or immune modulating medications and so forth. And really what we want to see is we want to make sure that your immune system is as ready as it can be to respond to this vaccine. So if you just received a large dose of steroids, we would encourage you to space that out a little bit afterwards, because your immune system is probably not going to be ramped up and ready to deal with that. If you just received any type of immune modulating type medication, we would space that out a few weeks as well and try to look at if there's a dosage interval, putting that as far away from an administration, but before the next one as you can.
Someone asked about frontline employees at Vincennes University, when they might be able to qualify for the vaccine.
So right now, the discussions from a state eligibility standpoint and broadening that have been the age-based. We're at 70, going to 65, as well as high-risk individuals, active cancer, dialysis patients, those that are known to have been affected by COVID, a higher acuity of illness. So it would really go back to those frontline VU or wherever individuals that fall into those categories would be eligible, but it's not based off of essential workforce. And there can be all kinds of debates about that,
Yes.
and you can quickly look across all of our bordering states, Ohio, Kentucky, Illinois, and everybody has a little bit different approach, and there's not a right, there's not a wrong. It's just everybody's taking a little bit different approach. But the Indiana approach has been age-based. We look for that potentially this week. If not, then the following week to go from 70 to 65, and then discussion of those high-risk individuals. But really, I haven't had any discussion of a essential workforce driven eligibility at this point, other than healthcare and first responders.
Okay, someone says that they're supposed to get their second dose of the vaccine this Wednesday, but her husband just tested positive for COVID Friday. She has no symptoms yet. Should she proceed with her second dose because she's being quarantined for 10 days?
You should.
100%, yes, absolutely. And the vaccine clinic would benefit from some information on that. I know our vaccine clinic has facilitated all kinds of, we can go out, help get the vaccination within your car, reduce exposure. So it would be nice to give the vaccine clinic a heads up on that ahead of time. But yes, it's very important because although she is not fully vaccinated, she's partially vaccinated right now. And while we can't state that the statistics are 95% on that first vaccine, they're still going to be fairly good, and we want her to complete her vaccination process.
And then someone asked about the second dose scheduling. So what's the process here for our first doses and how they're getting scheduled for their second dose?
Sure. When you come in for your first dose, at administration of your first dose, then your second dose gets scheduled. Here at Good Samaritan, where we're giving the Pfizer, it is 21 days from that first dose. So if you come in today and get your first dose appointment at, let's say, 9 o'clock, then we've got 21 days, which would be February 15th, that you would get your next dose at 9 o'clock. So same date or same time, 21 days from today, it gets scheduled. Now, what we're looking at is, as volumes have increased, if that were to become that day is full, then you would go to day 22, day 23. Really, the CDC has came out and said that there's a 4-day grace period. Ideally, you don't go earlier than 21 days, so we're looking at 21 days to 25 days. Now, there are things that come up, like somebody tests positive for COVID and is under isolation. You should not come into the clinic, and we push that out further. Or if somebody did have an acute illness for some other reason, or got hit by a car and end up in the hospital, and then 30, 40 days later, get your second dose. Ideally, that second dose is given between 21 days and 25 days. And when you come into the clinic for dose 1, your second dose is scheduled before you leave. And you will get a text message, and it will tell you that your second dose is scheduled.
Okay, that's all the questions today.
Great. Thank you all very much for joining us. We'll be back with you in a week and continue your due diligence. Things continue to improve, and as we march through these next few weeks, please, if you have the opportunity to go get your vaccine, please sign up. Thank you.